Hello everybody, Dr. Carlo Ojer, emergency physician. So before we get started with how to do this wound management laceration repairs, let's talk about how to put sterile gloves. Well, before you even get started with putting sterile gloves, you want to make sure you're as clean as possible. So make sure you wash your hands. Now, if you're wearing a watch, you need to remove it and wash your hands properly. Remember, you need plenty of water. You need to scrub in the soap. Please go as far as the surfaces you're going to be sterile, maybe even a little longer, so mid-forms. Please notice that even though I was wearing long sleeves, I rolled the sleeves up so I could do a better cleanup and so that my sleeves will not get on the way. Something I should have done that I did not was put my tie inside. Now, during a clinical shift, I normally do not wear a tie. Even if I was, then I would wear the yellow gown to keep all my clothing protected and to keep the patient protected from any bugs or any dirt or any particles on my clothing that could unsterilize the field, get it dirty. Notice that I use the towels that I use to dry my hands to close the water. Now notice that my tie kind of falls into a sterile field if I go in to do laceration or examine a patient. So tuck it in inside your shirt if you're wearing a tie, and then you won't have that on the field. So let's move into these sterile gloves and how to put them. Notice that this video was actually started to be done at a different time, and my sleeves are down. I'm wearing my watch, so as soon as I realize that, I'm going to have to take those off and protect the area, protect myself from contamination, and so on. So here I am rolling my sleeves up and getting ready. Obviously, you want to make sure you have the correct size. Tight gloves are nice because they fit very nicely, but they also compromise your circulation and your dexterity. Using too big a glove, then they get on the way, they're kind of falling off and whatnot. Here we open it up. You saw how I did it. It was a little bit difficult kind of getting in the middle of it and opening it up. You're only going to touch the gloves once with your unsterile hand, and you take a tiny little piece and notice that this is on the volar side. And this is important because you then are able to touch the other side if you need to better fit the gloves and stuff. Notice that I couldn't really get my pinky finger in there. Not a big deal. I can now go in like this, grab the glove and put it in like so. This one I can pull in and have an adequate fit, and then I can use my sterile glove to fix the other glove. And this time I'm not going to touch that side. I'm touching the dorsal side to pull it up. Now once you have a sterile feel like that, you want to keep your hands above the waist level and you don't want to bring them below your waist, and now you're sterile and ready to go to do your procedure. Now remember, as I said in other videos, lacerations are generally clean procedures, not sterile, so a lot of times you don't need sterile gloves, but if you need them, this is the way to do it.